One thing that I found very eye-opening was that two patients with Alzheimer's could look totally different and act totally different. So one patient might be super aggressive and very combative, and another patient might be just really calm and almost just shut down, and not really talk a whole lot. It just kind of depends on how severe it is, or even just person to person. That's something that I was not really aware of before I kind of went into CNA work. When people talk about Alzheimer's, they just think that someone's very forgetful of everything, which really isn't the case. I learned that the people with Alzheimer's, they know a lot from when they were young, for the most part. The patients I talked to could tell me about their kids and name all their kids, could tell me stories about whenever their kids were young, or when their wife was around and things like that. But they may have trouble remembering my name, but they could tell that I was someone that they had talked to before, and that I was someone who had helped them, and they knew kind of my role. But just putting a name with a face was kind of difficult for them. I think that's another thing that I learned, was that it doesn't matter if they know your name. I became frustrated with CNAs or other coworkers who would walk in and ask instantly, "Do you remember my name?" Because the resident would get very frustrated easily. And I think that's something that we wanted to get away from, because then once they became frustrated with themselves, then they really didn't want to do whatever we were supposed to be doing, whether it was getting them up for therapy, or even just simple activities like getting them dressed or something. They kind of became a little shut down because they were frustrated with themselves for not remembering your name. So I think that's something to take away from that, is just, it doesn't matter if they know if they know your name. What matters is that you're there and you leave an impact on them in another way. Like I said before, they could remember who you are, they could remember your face, but putting the name to it just isn't there. And so it's not something that you should really make important. Of course, introducing yourself again is helpful when you walk in, reminding them who you are, and then that will help them kind of put that face with who this is and why you're here. So that's what I've learned from working with people with Alzheimer's. So there are some different activities I found helpful with patients with Alzheimer's. It's kind of hard to do activities in the skilled nursing facility. I felt as CNAs we were kind of rushed to just move from person to person and get things done. So activities were kind of left up to activity coordinators, or they were done more in the morning, and I worked evening shifts, so that didn't really happen when I was there. But in the nursing home setting, one thing I found especially helpful for quite a few of the residents who had Alzheimer's was singing, or like playing music. Some of them didn't have like radios or things in their room, so I would just sing older songs to them, a lot of Elvis Presley, and that really kept them engaged, especially like when they were when they were kind of in a bad mood or weren't really engaged in like helping get ready for bed and things like that. Singing that song, or if they had a radio, playing some music really helped them to kind of calm down and to focus on what we were doing at the time. Other activities I found helpful, coloring is really helpful. And again, playing music while they're coloring also helps a lot. Talking about things, like kind of like word association. So like especially around like holidays and things, if you talk about like Christmas, what do you like about Christmas? And they go off of and talk about like, oh, maybe they like presents, and then you're saying like, what kinds of presents do you like? And just trying to do anything that really keeps them thinking. Of course, that's that kind of activity would be more for someone who's more verbal, and sometimes as the disease progresses, people become less and less verbal in that. But I think just trying to keep their mind engaged and trying to keep someone talking to you is just especially helpful for someone who has Alzheimer's. I think the most important quality of a caregiver working with someone with Alzheimer's is patience. It's very hard to work with these residents, especially those who have a very severe case of it. I know that I've worked with people who ask me questions, the same questions over and over and over again. And it can get very annoying, and it's hard to not be annoyed with someone because you know that they're not trying to annoy you. You know that they're just genuinely concerned, and that's why they keep asking these questions. And so just being patient and trying to reword your answers so that they can understand, or so that it sticks better, is just really, really important. And also just being kind or empathetic, knowing that it's not something that they want to deal with. They don't want to get like worried and freak out that they don't know where they're at. It's not something that anyone wants to do. So just kind of remembering that, being empathetic, and kind of putting yourself in their shoes. Like, how would you want somebody to treat you if you were totally confused and disoriented? It's just really important quality of a caregiver.